A new graduate nurse received the following order: 750 ml of lactate ringer is infusing over 5 hours. A macro drip IV tubing you need to be used. How many drops per minute patients should receive? So this question is different. We're looking for drops per minute, and they've given you macro drip IV, and then they'll give you how much you should infuse in 5 hours, right? You need to remember these numbers. Okay. There's something we call micro drops per ml. Okay, micro drops per ml. And this is usually, when you say micro, it's usually 60 drops per ml. If they give you macro, it's usually 20 drops per ml. Why is the difference? The micro is done used for precisely. It will give you small drops, but it's used for like pediatric. And so the tubing is very precise, very small. So it takes a long time for that fluid to go away. So the drops are many in a ml. But if it's a micro, it's a large bowl. So the drops are less in a ml. So it's very confusing. Even though we think macro is bigger, the macro is actually the smaller drops. Okay, smaller drops. That means the drops you have small amount of drops in a ml, 20 drops in a ml. But if it's micro, it's very small, so it takes a long time. Okay, and then the way I do this is I don't use formula. I use dimension analysis, but I'll show you where that formula came from. Is to prescribe those, okay, times the available will always give you the answer. You just have to manipulate the formula, the way the dimension goes, and you get the answer. And I will show you. Straightforward. You don't have to do anything. Key factor, okay? So this is the way I do it. What is my prescribed dose? They give me 750 lactate ringer over 5 hours. So 750 ml of lactate ringer over 5 hours. Then I go and look at the answer choice. I need drops. As soon as I write my prescribed dose, I need to look at the answer. I need drops per minute. That means my answer should have a minute at the bottom, minute at the bottom, and then top is what? Drops. So I write it here like that. Now, if I need to get minutes, I need to convert these 5 hours into minutes. So I have 1 hour here into what? 60 minutes. That means this hour cancel that. Then I bring my prescribed and my available dose. What is the available dose? It's the macro. The macro, I told you, is 20. So, and I need to have drops on top. So 20 drops, I put it here per what? ml, right? So ml, that's what I give you. ml, cancel ml. So I'm left with 750 times 20 drops over 5 times what? 60 minutes. That's all. And that should give you drops per minute. That's your answer right there. Right? This is the way the answer will be done. And the answer that you get is 50 drops per minute. So this is how much drops you're going to get per minute. And based on that, when you calculate, straightforward. So it's not that and difficult. You just have to write it this way. So this is the first one. A nurse received an order of infusion of what? 1,000 ml over 8 hours of lactate ringer. If the, once again, micro drip factor, this one they've given you. If they don't give you, you assume micro is 60 drops per minute. And the macro is 20. But if they give it to you, use what they've given to you. So calculate what? The drip per minute. Whatever they've given you is what I'm going to use. I'm going to write my answer here. Drip per minute. I have to make sure my answer is like that. And I said, what is the prescription? An order. It said an order, therefore I know this is a prescription. I need what? 100 1,000 ml over what? 8 hours. Then I look at my answer. Is it minutes? Right away, I'm converting you to minutes. So I have 1 hour over 60 minutes. That's all. Then I cancel the hour right away. Now available is your drip rate they've given you. Your drip GTT has to be on top. So I will leave it that way. 15 GTT, that's the drip, over ml. And I see ml cancel. And you can see you have drip per minute. So you have what? So we have 31. Now answer choice 31.25. Look, make sure that on the test, they will tell you run it up to the nearest whole number. Don't write it, you get it wrong. Because most of these you got to put in the numbers. So if they ask you to run it to the whole number, it just will be 31. There's no 31.25 drip. It will be 31 drip per minute. So be careful.